Assalamualaikum dear doctors. In this video I am discussing a video station. So first we'll watch the video, then I will discuss what type of question we are expecting from these video stations. First question is that what I observe in this video. So I can see there is a neonate who is a 2 days old neonate in hospital setting, and also seeing that there is rash, petechiae and purpura on the face and the whole body, trunk and back. So that is a neonatal thrombocytopenia, and on my top diagnosis is neonatal thrombocytopenia. So what are the differential diagnoses? Differential diagnosis we can be classified like, if the baby is ill, then we can say that the congenital infection, that is torque infections, sepsis, necrotizing enterocolitis, DIC, hypoxic ischemic encephalopathy and metabolic MMA. Now well baby and normal maternal platelet. So these are the DDR, neonatal thrombocytopenia. This is the case mainly come. Then TTP, idiopathic any TAR syndrome, Kasabek-Merritt, trisomy 21, 18, 13, IUGR, maternal diabetes mellitus and platelet insufficiency. Well baby and maternal thrombocytopenia. Both baby and mother is affected. So it can be autoimmune conditions, maternal disease like ITP, NSLE and maternal drugs like heparin. What history would like to ask? So the history would like to ask the patient is that the onset, course and duration, distributions, blanching or not, bleeding from any side. Then full term or preterm activity of baby, well or ill. Then MEM, the mother platelet count and history of any diabetes mellitus, placental insufficiency, ITP, SLE, drugs, preeclampsia, IUGR, infection, cytomegalovirus and rubella. We'll also ask about the parental history of hypoxia, feeding intolerance or history suggestive of necrotizing enterocolitis. Family history of metabolic or bleeding disorder. So these are the history we'll ask. Now, what examination we will do in this patient? We will do the vital signs, that is heart rate, respiratory rate, blood pressure and capillary refill time. And we will check that well or ill, skeletal any deformities like TAR syndrome, dysmorphic faces as Down syndrome. Investigations we will do full blood count and platelet count, septic workup and coagulation profile if unwell baby, active bleeding and severe decreased platelet count less than 50. Moderate platelet count with no history of placental insufficiency or PIH, that is pregnancy-induced hypertension, torque if suspected or persistent unexplained platelet. Check mother platelet count in health record. About the management of neonatal thrombocytopenia, that is avoid heel prick, IM injection, invasive procedure and if needed discuss with the on-call consultant. Check the platelet count daily until more than 100. If sepsis, give the IV antibiotics. Platelet transfusion if falling the platelet count, platelet less than 25 in well baby or NAIT. Platelet less than 50 in the following situations. These are clinical instability, coagulopathy, NAIT and history of affected sibling of intracranial bleeding, body weight less than 1 kg and age is less than 1 week, current minor bleeding, previous major bleeding, PDA, TTT with ibuprofen or indomethacin. Treatment of NAIT including check platelet daily till more than 100, check the mother platelet count, arrange cranial ultrasound, obtain the blood from the baby and parent for platelet typing of antibodies and liaise with hematology department. Platelet transfusion of HLS negative platelet if bleeding or platelet less than 50. After platelet transfusion, if severe platelet less than 50 or hemorrhage persists, give IV immunoglobulin. Target to keep platelet more than 25 for first week of life as long as bleeding continues. TTT of neonatal autoimmune thrombocytopenia. So for autoimmune thrombocytopenia, send cord blood for platelet count. After 24 hours of life, check the baby platelet count. If thrombocytopenia, check baby platelet count daily for 3 to 4 days or until more than 100. If platelet count less than 25, IV immunoglobulin plus minus steroid. Discharge if platelet more than 100. Receive IV immunoglobulin, recheck platelet after 2 weeks as may require second course of IV immunoglobulin. So this is all about neonatal thrombocytopenia video station. Please do subscribe and share. MRCPCH with Dr. Amma Chaudhuri. Thank you.